Hey, welcome everybody. Thank you. Good afternoon. My name is Deanna, and I am a member of the Education Committee, so I'm delighted to welcome you to Global Credentials. We have here U.S. Standards, a fresh look at equivalency in physical therapy education. This applied workshop is going to get into some of the applied technical aspects of responsible AI in the health and healthcare space. So the speakers for this session are Ron Barreto, Melissa Howdeck, and Doreen Stiskel. And Ron was the chair of the Coursework Tool 7 Development and Validation Task Force. Doreen represented CAPTE on the Coursework Tool 7 Task Force, and Melissa, an associate principal consultant with the DCI Consulting Group, served as a consultant to both the Coursework Tool 7 and the PTA Tool 3 Development and Validation Task Force. So you can find their bios on the event app. They have valuable information to share, and we also encourage your participation. If you wish to ask a question during the Q&A portion, the members of the Education Committee will have a microphone for you, so please abide by the ground rules in the program notebook so more attendees have a chance to ask questions. And don't forget, at the end of the session, use the QR code to complete your evaluation. Now I turn the presentation over to the speakers.
Thank you so much. It's a pleasure and a privilege to be here. I envy those who have ice cream. I wished I had ice cream. So the session is on global credentials, U.S. standards, a fresh look at equivalency in physical therapy education. So that is what we will talk about for the next hour or so. And one of the things that we will look at in terms of presentation is the outline. Now, this is just a rough outline. We might go a little over, we might go a little under, but this is pretty much what we will be doing. I'll do some introduction, and then we have Doreen from CAPTE being able to share with us what CAPTE is all about and how the changes in their standards have affected the way we need to look at credentialing. And then we have Melissa from DCI Consulting, who will help us understand the methodology behind how the changes in standards translate to the new coursework tools. There are a couple of updates that we want to share with you. Justin was supposed to be here, but is unable to. So I will be covering the coursework tool updates for the PT programs, and then I'll also cover PTA Tool 3 updates, and then we'll have conclusions and questions at the end of that. So hold on to your questions until the end. I think what's interesting to look at is that when you look at Coursework Tool 7, then that means that there have been 6 revisions to the tool. Does that make sense? So that CAPTE has, at the very least, massaged their standards, changed their standards for us to be able to adapt the coursework tool. And for PTA, we're discussing PTA Tool 3. That means there were at least two revisions to the a PTA tool. So when you look at the session description that's listed there, I just wanted to highlight several things. I've said, if you were here in the previous session, I've said that credentialing always follows education. That means that credentialing can't stand on its own. Credentialing has to have a referent to be able to see what standards are in play so that a credentialing tool is able to be developed. And so for the U.S. Standards, it is the CAPTE standards, Commission and Accreditation in Physical Therapy Education. And so that's the way that we will look at evaluating foreign educated physical therapists and PTAs. So that's why we have a representative from CAPTE here and a representative, as I said, from DCI who assisted us in the process. There was, the FSBPT developed this task force and had a panel of experts who were able to provide input on the development of the Coursework Tool 7 and the PTA Tool 3. And so this session, as you can see there, will explore the collaborative process behind the creation of these updated tools, including methodologies, stakeholder input, and how they better align the evaluation of the international education credentials of foreign educated physical therapists. And so that's the main session that we will be discussing this afternoon. I do want to acknowledge those who have participated in the task forces. So listed here are those members from the coursework tool 7 and PTA tool 3. Are there anybody here who's a part of these task forces? Can you stand up and be recognized? There you go. Thank you so much. Thank you. So we have a whole slew of individuals, educators, we have regulators, foreign educated physical therapists. We've had representatives from credentialing agencies be there so that they can provide input on the development of the tool. Our appreciation goes to the Federation of State Boards and FSBPT because they provided oversight and continuity to the task force efforts. So we did a lot of pre-work and then on-site work and then post-on-site work. And so this is the main thrust of what we will be discussing this afternoon. So as I said a while ago, CAPTE has standards. We align with their standards to make sure it's reflective of what is going on in PT education. And so at this point, let me call on Doreen, because she'll be discussing CAPTE and the entire process that they went through with regard to the standards modification. So Doreen.
Thank you, Ron, and thank you all for this invitation here. So what I'm going to try to do in just the next handful of minutes, describe some of the changes, kind of provide just an umbrella of what CAPTE is, and then talk about the changes. I gave a talk last week. It took me 4 hours to go through those changes. So we're going to do it in 4 minutes or less. So first of all, the Commission on Accreditation in Physical Therapy Education, if you never knew what CAPTE meant, there's the definition to add to the glossary. We are the sole agency that is recognized by the U.S. Department of Education and the Council for Higher Education to provide both physical therapist and physical therapist assistant education. And just to kind of give you some numbers here is currently, as of December 2024, there were 314 PT programs and 387 PTA programs. PT education is on the rise. That doesn't include some new expansion programs that have been approved, nor the new developing programs that are out there. But we are looking at, if institution wants to start a new DPT program, the soonest they can get in queue is 2030. Going into 2031. And we do 5 reviews for both PT and PTA twice a year, so that's 10 programs. So we're looking at continued growth. So what does that mean student-wise? CAPTE serves over 48,000 students who would be typically enrolled in program review and reporting. So what does CAPTE do? They are an independent body that makes their own decisions. And they meet, and as a matter of fact, we had panels meet just 2 weeks ago, and I know we have a member of one of our commission panels here in the room, and the board will meet next week and roll out those decisions. Candidacy programs get their decisions within 14 days, which is, I think I did the calendar math, that should be November 17th. And if you're an accredited DPT program that has some sort of action, you'll get your report on December 4th. So we have rules and everything that follow along with the process. CAPTE and the independent decision-making also includes making its own sets of standards and required elements. For those of you that have been around in education, they used to be called the evaluative criteria. And so that's why that's on there, but they're really now standards and required elements. CAPTE also makes its own decisions about its processes and its practices. And so it has a document called the Rules of Practice and Procedure, which is what USDE and CHIA really monitors CAPTE on for their compliance and their reaffirmation of accreditation. It sets up its own fees, so what It has an independent budgeting group, et cetera, from that. And even though it is under the APT umbrella as kind of a related component, CAPTE also elects its own members. So there's always an open call, and here's the call I'm putting out to you. If you think you want to be a CAPTE reviewer, and we'll talk about who that can be, you can just go to the CAPTE website, become a reviewer. Once you've done a minimum of 3 reviews, we have a nominating committee, and then you're invited to be elected to run for a position on the panel and or the board. So that really is done just under the CAPTE umbrella. So what does this commission look like, or what might you want to sign up for? Plug, plug, plug. Is that there is a new structure that went into place 2 years ago. And what that is, there's a CAPTE decision-making board. Those are 13 individuals, which includes 2 public members. So very much like you, we have public members. It includes PT educators, PTA educators, PT clinicians, PTA clinicians, and higher education administrators. So it really represents quite different perspectives, including non-physical therapists on that group. And the board is the group that makes all the decisions, but they work off the recommendations from the 6 panels. And what these 6 panels are, you can see on the left, there are 3 that are highlighted in yellow, and the 3 that are on the other side, is that they are identical for PT and PTA. So there's a panel that looks at the candidacy and initial programs. So a candidacy program is, do they get the green light that they are now have enough in place to assure those pioneering students are going to be able to graduate and sit for that exam. And so that same panel is also going to look at the program when they're graduating that first cohort of students as well. Then we have a different panel that looks at programs going for reaffirmation, because we have PT programs that have been around for 75, 85, 90 years. It's very hard to compare a program that's 90 years old with a program that's graduating its first cohort. So we have very much like. And then there's a third group that looks at applications for substantive change, which might include increasing their class size, looking at creating an expansion program or a variation off of their program, and also the annual public notices or information that might come into CAPTE. So that's kind of how the whole structure works. But what is CAPTE about? And I made that comment earlier about having its own set of rules and practices. So rule number 1, point number 1. Accreditation serves as an indicator of quality by establishing standards against which all physical therapy education programs can be measured. So that's important. For all of those 700 programs that I described between PT and PTA, everyone has to be looked at through the same lens. And what is important to this, just like, re-upping your license, you're dependent on that applicant to be honest and truthful. So the reliance in CAPTE is placed on the information, the data, and the statements that are provided by the program. So institutional integrity is also at the heart of all of this. And so that's important. All programs, all physical therapist programs are judged equally, and all physical therapist assistant programs are judged equally. And why would that be? And that is because CAPTE's purpose is really consumer protection. Doesn't that sound a lot like FSBPT? So I've heard the terms that you're really about the regulatory group. CAPTE is really about the compliance report to that consumer protection, because you really pick up on that graduate who's now ready to take their first MPT exam to show that they're entry level. CAPTE is really looking at programs. Do they have all those activities that will bring an applicant from the point of matriculation to graduation so that they are prepared to go into that workforce clinically as well as for that exam. So that's what it functions to. And as I said, they're the sole group that looks at both physical therapist and physical therapist assistants. And so how does CAPTE define quality education here? Or what is it looking for? What's its main goal with the consumer protection? It's going to prepare graduates for competent and ethical practice. And so there's many of the standards that look at that. That can include the curriculum, that can look at student success measures, that can look at admissions information, all those things from start to finish. It also looks at career flexibility. CAPTE makes sure, and you'll see in some of my couple slides coming up, across the spectrum of practice. They can't just graduate students for an outpatient environment or just to work at a certain subsection of the population. It has to be across the lifespan, and it has to be with those common conditions. Because if you've worked with the exam or looked at the content analysis, it's really very much reflective of that. And it also has to have values, core values associated with the profession. So I heard, people talking about soft skills, life skills, all of those pieces for that. And it also mandates that the experiences prepare individuals for lifelong learning. So when you think about this, yes, they're being prepared now, but they also have to be prepared for tomorrow. And so circling back to consumer protection, that's not just the patients that they treat or their family, but that also includes the state licensing boards. Because if you're accepting a student or validating a student to take that exam, you have a process that says they have to graduate from a CAPTE accredited program, or through this, look at that equivalency. So there's a lot at stake here from getting that graduate there. And I just wanted to put one image up. And I know there's a fellow New Jerseyite in the room with me, and I've met some other people. I'm very proud to say I've been a physical therapist for 44 years. And I remember my first job, and we were in, an acute care, and all the patients came into the gym, and there was another brand new grad there and we were looking. Every patient came in, sat in the wheelchair, they got the cane with the weight around it and did arm exercises with the cane, and then the weight got put around the ankle, and they did their kicks and they did their hip marches, and they walked twice around the parallel bars, and that was PT. We've come a long way since then. So if you think about that, open chain exercise, in the 90s, we learned about the value of a closed chain exercise. And then it went from open chain to closed chain to functional training. We started to embrace the ICF model. And we had to look at personal factors, and we had to look at those pieces. And then, all of a sudden, we're looking at evidence-based practice. And I was thinking, wow, what do we need to do to serve our patients today? The state of Utah has to be prepared for primary care now. So that is that lifelong learning piece that I just wanted everybody to glean from this one picture. It's how much we have changed in meeting the needs of our patients. So if we're going to be changing, what does CAPTE need to do? So what's built into its own set of rules is that every 5 years, CAPTE must do a plan review and revision of its standards and required elements. And so it happens, and the first step is to take comments from the communities of interest. These might be the programs that are going through a reaffirmation or initial accreditation or candidacy. They could be the clinicians, they could be member of CAPTE, they can be the agents from the federation or from other constituent groups, and they look at these. And if they're seeing there's enough change to be warranted, it's time for a new set. And so if you think about the new standards went into effect in 2016, and now we have 2024, again, think of how much practice had to change in that short period of time. So a standards review group or SRG group is convened. It starts to address, they start to write, and it keeps putting out for public comment to come back to kind of get to a new landing piece. And that's when the board finalizes, and then they approve all of this. And what is interesting that, again, when you look at these, how they have changed, you could see the evolving parts of practice, which I'll be talking about in the next few slides. And then we publish these. And so you will see on the next slides, they were first published in 2023, but programs only are supposed to come into compliance with that starting now in 2026. They've been given 2 years. This is what's coming up in the horizon. You need to adjust and get your framework like that. So if you were to go onto the CAPTE website, whether you went to the PT standards or the PTA standards, I just put them side by side, and then you could see there's a little notice on the bottom. It will tell you that they were adopted in 2023. Oops, they were already revised in September 24, and then they were updated again in March, and oh my gosh, in June again, and then June yet again, and September, and yet again in September. Part of that reason, you see something called stay language in there. There has been some governmental and institutional pressure that you might not be able to talk about diversity or inclusion or things like that. Remember I made that comment that CAPTE can only judge all programs, and certain states or institutions don't allow CAPTE to, or won't allow those programs to speak to that. So we have stay language in place. It still is in the standards and review, but programs, because they may not be able to answer that, they're not judged on those pieces. So in doing this and looking at now if programs have to come into compliance, how does the commission and the reviewers and the community wrap their brains around that? One of the first things that we started to look at were some guiding documents and the Guide to Physical Therapist Practice. And for those of you who are not familiar with that, it sounds very much like the way the MPT exam is. You have examination and evaluation. You've got content on prognosis, diagnosis. You have content on interventions. It really works through that patient-client management model. One of the other documents, and I just put up the blueprint that you have here, but we also talk about your exam content analysis. This is written right on the published standards, that if this is about entry-level practice, the Federation's documents are integral to the formation of the program's curriculum. So I just kind of wanted to put these two things out there, that this synergy, again, between the two groups is not only about consumer protection, but what is the expectation of entry-level practice. So what really represents the changes? CAPTE went from 8 standards to 7 standards. And I purposely put a cross out through the 8. I didn't eliminate it. It wasn't so. All it is 8 was describing your resources, but in standard 2, you had to assess if you had enough resources. So wouldn't it make sense if you just describe and assess at the same time? So I kind of, in my speech last week where I had to talk about what is different, I kind of used the analogy, it's just tossing the salad differently. You know, you're just putting the same material, but the information in a little bit different place. Important part about this slide, number 1, mission. There's kind of a CAPTE saying, if you've seen one program, you've only seen one program. And just like you have 52 jurisdictions, the 50 states, Puerto Rico, and DC. Oh, okay, sorry, 53, I'm so sorry, 53. Everybody's missions and operations are a little bit different, but yet your focus and your outcomes are very similar to that. So that's why everything starts with the mission and the outcomes. And there's 3 key outcomes, and I tell programs when they do well, they're going to do glee, they're going to sing, because it's graduation rate, licensure rate, and employment rate, which is those important things. And CAPTE really takes a strong view of everything you should do should match those outcomes. If those outcomes start to drop, and I heard that discussion, the MPT exams are starting to change. So if those scores are changing, the programs are expected to be looking at closely at what's happening, which is standard 2. Integrity is standard 3. The faculty, so think of all this growth, thinking, I'm a retired faculty member. Where are those people coming to teach those students, and are they qualified? That's what 4 is about. The students themselves in 5, and then what pretty much focused for the group that we worked on was 6 and 7 is the curriculum. And so again, it looks like a lot of change, but it was kind of mixing up the salad. And instead of just only mixing it up, it's kind of putting it in a blender in your little Ninja, and you now have the kale smoothie. Still the same ingredients. So what changed? In the PT Standard 6, which is the plan and the overall umbrella, it gave programs the ability to be more flexible, to tell their story, to look at things. And a key change here was the minimum number of weeks and the minimum number of semesters. It had been only 90 weeks. Every program has to have at least 96 weeks of instruction. It also changed the number of clinical hours it defined of what was full-time. When the group was going through this and we looked at it with the course tool, it was based on what the federal government called a full-time week for hours. And that was 32 at that time. And so that really then helped programs who might be putting students in education. They were doing pediatrics in the school-based systems. They often had maybe 40, 34, and they were still going to be in compliance with that. So the overall number of hours was reduced. And then the organization of this is they just kind of compacted this, that if you're talking about learning experiences, they should match the outcomes or the objectives or the way you're going to test those students. So instead of being separate and distinct, tell your story of what's your philosophy, what are your objectives, how are you going to meet those objectives, and how are you going to know if the students did this? And so that's what it did in terms of those pieces. And when you look at the PTA piece, again, what really changed was really about the minimum length of the program. It had to be at least 4 semesters or 64 weeks of instruction. And they had a big change to their Clin Ed piece. So their hours kind of stayed the same. I think that was the minimum of 520, but they needed 12 weeks of full-time education, and one of those terminal had to be at least 6 weeks continuous. And part of that thinking is some programs only had 4 weeks or 5 weeks. You might not be able to follow any patient from the time of the initial exam to the discharge in that. So that really would help the physical therapist assist in seeing kind of a whole episode of care going through all of that. And again, they had the same change in number of hours and the same kind of reconfiguration. So what did the content look like? And this is where I said my Ninja blender went in. Got rid of less elements. There used to be a checklist of, did you do airway clearance techniques? Did you do test and measures for all of those guides and things? And what it did, it kind of shifted to thinking about major systems. If you had a student, or if you yourself are a practitioner, you don't go in going, you know, I haven't worked on mobilization or mobility techniques today. I'm just going to practice on every patient. Rather, you have a patient with a diagnosis or a dysfunction in a cardiovascular system. What tests and measures do I need to treat that patient? I have a patient who has a compromised neuromuscular system. What kind of interventions are going to help them to improve and get back to their function? So what you can kind of see in that little box there, it used to be those interventions, there was a whole laundry list. Now is what are the best interventions based on conditions related to. So I kind of say it's still the same ingredients, it's just blended up a little bit differently. It's in a smoothie. Okay, that makes some sense. It also took the 7 A's and instead of reporting about anatomy, now you're reporting about anatomy, physiology, et cetera, and health across systems. There is some new content areas. Pain and pain experience. That is very important in our literature today. So that was added, lifelong learning, leadership skills. Especially at the DPT level, they need to learn those leadership skills early. Healthcare disparities, social determinants of health, all of those are important. And then again, as I said, across the lifespan, spectrum of care and common conditions. So what changed on the PTA level? It's kind of the same thing. Less is more, and it shifted to the major systems. They eliminated the task lists, and so what you could see here from the PTA is they have to be able to do tested measures for the musculoskeletal system. Does it mean they don't have to learn goniometry or manual muscle testing? No, it's still there. It's just blended up in your smoothie, and you're just ingesting it differently there. They also have some new content areas. So the movement system and the movement sciences have added to the biological science because they need to be that physical therapist extender and understand many of those same things. Body system interactions. If they are getting handoffs and they have to understand how all that plays in there. And again, across the lifespan, the spectrum of practice and meeting, understanding those common conditions. So in a nutshell, instead of 4 hours, I hope you all understand the changes and bringing those changes to this group so that our next speaker, Melissa, can come and talk about how that was used in our process.
All right. Thank you all. Thank you, Doreen. Appreciate the opportunity to be here with you all this afternoon. As already noted, my name is Melissa Haudick. I am a little bit of an outsider. I am an industrial and organizational psychologist. I have no involvement with physical therapy, but I have absolutely loved the opportunity to be here and get to meet all of you. This is a wonderful community, so I wish all of our professional organizations and meetings could go like this, because if they did, they would be very smooth, very organized, and everybody would be in a good mood. So I just want to say thank you, because this has been a wonderful opportunity for me, and I have appreciated every minute of it, so thank you. And even the work that we got to do with FSBPT, with folks from FCCPT and the task force individuals that were solicited to support this effort. Ron stole a lot of my thunder, so a number of the things that he already mentioned, I'm going to touch on again. But as an industrial and organizational psychologist, where our area of expertise is really understanding human behavior and understanding that human behavior in the workplace. A lot of times that takes the form of researching and analyzing the job itself, what it takes to be successful in that role, the skills and abilities that might be needed to perform successfully, and then using research and established measurement techniques to develop tools for evaluating those specific skills and abilities, and then doing follow-up research and analysis to ensure that it is validly assessing those skills and abilities and reaching the desired outcome that you're hoping, a quality candidate, the right fit, whatever it might be, and ensuring that you're able to conduct that measurement consistently. We brought those same principles to this work. This is one of the reasons why FSBPT decided to work with DCI and IO psychologists for this particular work, so that we could bring that lens to this effort and making sure that the efforts we were making to content validate the coursework tool content in alignment with the CAPTE accreditation standards would meet appropriate standards, and we could also evaluate and make sure that it was going to be able to be used consistently, reliably across evaluators. And just in case there are folks that are maybe less familiar with the coursework tools, so the coursework tools were originally created by the Credential Evaluation Committee, which was part of FSBPT. It has since shifted and is now owned and maintained by FSBPT. And so that is why they came to us. We were fortunate, DCI was fortunate to work on updating and validating the coursework tools back in 2016, which was the last time that the CAPTE standards were updated. And so we were very thankful to be on the short list again for supporting this work again. And again, just for those that are less aware, so the coursework tools really are a standardized and professionally accepted tool for evaluating the equivalency of, I was about to say foreign educated, I've learned there's a new term, internationally educated, PTs and PTAs, so if I say foreign educated, just know that I use those interchangeably. So evaluating those credentials to ensure that they are equivalent or in line with the US-based standards with the CAPTE accreditation standards. And I went too far again. So for DCI's work, our goals were threefold. One, we want to make sure that the coursework tools were in alignment with the new CAPTE accreditation standards. Through that review work, we would identify necessary refinements to the existing coursework tools and create a new version of both the PT coursework tool and the PTA Tool 3. From there, we would conduct additional research to ensure that evaluators using those tools would be able to do so reliably and ensure that the decisions made or the inferences made based on those evaluations do ensure proper credentialing. Give me my water, please. Thank you. Appreciate it. So, to accomplish this work, DCI employed a multi-pronged methodology, which first included us reviewing, as Doreen put it, the tossed salad. We needed to understand how that salad had been tossed so that we could understand the impact of the changes that were made to the standards from the previous versions. And then we took steps to do some initial alignments of those updated standards to the existing coursework tools just to see the level of scope of change that was potentially going to be needed to those coursework tools. We then set up and facilitated some on-site workshops with the task force members that have already been displayed for you all. So we did have the opportunity to meet with folks in person, go over and review and confirm those alignments that DCI had initially done, get confirmation of those, and also work through any necessary refinements to the coursework tools. We also supported FSBPT in conducting some additional research into the credit hour requirements for the PT coursework tool. Not only does CAPTE set the professional education total credit requirements, we also wanted to identify what a total credit requirement would be for that PT tool. So we assisted with that. And then we finished it up with some reliability research, and then we documented all of our research efforts and the results. And I will say that that report is still in review. So we have actually just come to a point where we finished up our research and analysis efforts, and that is now in the process of being reviewed and approved. So there are final coursework tools, which Ron is going to talk a little bit more about in a little bit, but they are still in the process of getting that final review and approval. So Ron already listed all of the wonderful task force members that we had the opportunity to work with for this effort. We wanted to make sure that we had individuals in the room, not only that had expertise in the field, whether it was for PT or PTA, practice, education, also having folks that were from the CAPTE accreditation group, as well as having individuals that had experience using the coursework tools and using it to evaluate those foreign credentials. So we wanted to make sure we had the representation in the room. And then for the on-site, Again, as I mentioned, DCI tried to take some steps to streamline that agenda. We had 2 days on site and we wanted to maximize the time that we had with the task force members. So we did that preliminary review and alignment to identify which CAPTE accreditation standards or the specific standard required elements within each of those standards were relevant to evaluating international coursework and credentials. So we did that initial alignment. We identified areas where we're like, oh yeah, okay, the existing coursework tool content is definitely need to have some revision. So we wanted to try to highlight all of that content up front so that when we got on site, we were able to just hit the ground running. And that's exactly what we did. Once we were on site with the groups, we were able to get everybody on the same page, and then we actually split up and had 2 separate task forces. So we facilitated a PT session and a PTA session just because of the differences, and the differences not only in the standards, but in those coursework tools themselves. So we split up, but we had the same methodology in both of those groups. And that really was to, ask the experts in the room to verify for us and help us confirm the alignments that we made, understanding that, or identifying those standard required elements that we felt were relevant to the evaluation of foreign credentials. And then once we identified that relevance, then determining whether the existing coursework tool content effectively and appropriately captured that information from that internationally educated individual or the coursework that they had completed. So based on those discussions, we were able to identify, okay, is this relevant? Great. Is it captured? Is it captured appropriately? No. Let's designate some refinements that we need to make. Through this process, as you might imagine, the new coursework tools were born. We were able to identify those refinements and actually work as a group, as a team, to make the specific refinements to the coursework tool content. We also took this from a reverse lens as well. We wanted to make sure there wasn't any existing content in the coursework tools that was outdated. It was no longer relevant to the updated CAPTE standard. So we came at it from 2 angles just to make sure that the final coursework tool content was relevant and it was going to be most effective in evaluating and aligning with those US standards. As noted, in addition, we wanted to support FSBPT in identifying a total credit hour requirement for that PT coursework tool. As I noted, the CAPTE standards do set a credit hour requirement for professional education, but they do not provide a specific requirement for that pre-professional or prerequisite coursework requirement. They do set general requirements about having a baccalaureate degree, but around specific courses or specific general education that needed to be completed, there was not a specific total credit hour requirement. So DCI supported by doing some additional research, and our target really was to identify a credit hour requirement that met more of that lower bound threshold for accredited programs in the US. So, right, different program types, you've got 3+4 program formats, you've got 3+3 program formats. So we wanted to shift towards at least kind of that minimally acceptable, that lower bound threshold, but is nothing excessive of what you would expect from a US-based program. And so through additional research, we were able to work with Doreen to get a lot of program data, accreditation report data, and a number of other resources. We did the research, analyzed to really understand where that confidence interval was as far as what is kind of that lower bound threshold that we're looking for. And then we had the opportunity to meet with a group of task force members again to discuss our recommended threshold for that pre-professional education requirement. And we also met to discuss any additional specific course content requirements for pre-professional education that we thought would better align with US programs. And so through that review and discussion with subject matter experts, we did land on a total course requirement of 186 credits total, and that's 96 for the professional education and 90 for pre-professional. And then lastly, as I noted, DCI conducted some reliability research, and we did this to evaluate the consistency of the evaluations using the new coursework tools. So these were this research was done using the new coursework tool content. And this was a multi-step process as well. So we had the opportunity to get a handful of existing coursework tool evaluators from varying agencies across the US, and they participated as our reliability study participants. And so we first trained them on the new coursework tool content. We collaborated with FSBPT to provide them an update on how the coursework tools had changed and get them trained up on what that looked like and how to use that in their evaluations. We also made a number of revisions to the guidelines, which is the supporting documentation that they use in completing their evaluations. So we got them trained up on that. We had them complete a calibration exercise. We all evaluated the same internationally educated candidate packet, so they all evaluated the same one. We compiled that information, determined how much agreement they had, and we met with them again and said, okay, we're in alignment here, but there's a couple places where we need to talk about this. Can we add clarity? Can we clarify something in the coursework tools or the guidelines? And so we got alignment through the calibration exercise. From there, we gave all the evaluators a couple more packets to evaluate, and then we collected that data, analyzed it, and from that analysis, we determined that there was strong agreement across evaluators for both the PT and the PTA coursework tools. And so all of this to say, based on the work that we did to content validate the coursework tools with the CAPTE accreditation standards, the use of subject matter experts, and the reliability analysis, in summary, DCI's conclusion is really that the use of the coursework tools for evaluating the equivalence of coursework completed by internationally educated PT and PTAs against the CAPTE standards really is robust, it is reliable, and it is defensible in its new and updated state. And now I'm going to turn it over to Ron, and he's going to tell you a little bit more about the changes to the coursework tools.
Fantastic, thank you. So you've heard about CAPTE and the changes that went on to the standards. You saw the methodology that went with looking at the standards and trying to update it and including subject matter experts. We will now go into a more granular approach to look at those different types of changes. And so what you'll find here is what's known as a crosswalk document, where on the right side you will see what the current standards are, and then on the left side is what the proposed standards are, the new one. So let's look at them. We'll start off with the coursework tool 7. And in terms of big changes, what you will see, so if you look at a coursework tool, there is Gen Ed, there's Professional Ed, there's Clin Ed, and then the total credits. So when you look at from the bottom, it says there, this is for PTs. There's an increase from 170 to 186, which was alluded to by a while ago. And so we will look at Gen Ed, for example. You see there that physical science, chemistry and physics has increased from 1 to 2 courses. And biology, 2 course minimum, and specified human anatomy. Mathematics now requires statistics. So these are all Gen Ed. When it comes to professional education, there's an increase from 90 to 96. And based on the changes in CAPTE, we had to look at examination and evaluation. So we will look at that in terms of the crosswalk document. And Clin Ed, based on the new CAPTE standards, has decreased from 22 to 20. So those are the big changes. So let's look at them individually. So this is, again, the crosswalk document. The one on the right is the one that is 2016, and then the one on the left is the 2025. So you can see the items that I've mentioned already in terms of professional ed, clinical ed, and total ed. So those are the changes that happened in terms of those total numbers of credit hours. Now, let's look at Gen Ed. So remember, Gen Ed, professional ed, Clin Ed. So let's look at Gen Ed. Communication and humanities, that's part of the Gen Ed. There aren't any changes to Gen Ed. But when it comes to physical science, in terms of chemistry and physics, there's an increase of 2 for each of those. Biology increased from 1 to 2, and there is a term change where we added the term human to the human anatomy and then physiology. Social behavioral sciences is no change, and mathematics now includes statistics. So let's look at them. So this is the crosswalk document for those. Okay, again, the one on the right is 2016, and the one on the left is coursework tool. And I have to apologize, some of the numbering is off, so don't look at the numbering, just look at the content. All right, so you can see here what's new. You can see here what's new. Motor control and motor learning is new to the new standard. Okay, and histology, we have histology in the previous coursework tool, but now it's been changed to say cellular and tissue health. In the previous standard, you have psychosocial aspects of health, disability, and physical therapy. It's basically psychosocial aspects of health and disability. And then the last one, item 14, the one there in the bottom, is new based on what Doreen has discussed about pain and pain science. So this is an expectation for the coursework tool for professional education of foreign educated or international educated. Now, another aspect of professional education is what's known as health, medical, and surgical conditions. In the old, in the 2016 version, you called it medical science, but now we've expanded it to say health, medical, and surgical conditions. And so it has increased from 11 to 17. And so I want to show you that. So the one on the right are the things that are there, but the one on the left, the one that I want to show you, you can still see on the right the systems, right? And the lifespan. But we've added a whole number of things. So when you look at, when you look at, let me make sure. So when you look at the new content, there it is. You have gastrointestinal, hematologic, hepatic, and biliary. So that's now the new standards. For foreign educated, does that make sense? Because the US standards have that, and that's very important to think about. When you look at cardiovascular on the right, it had cardiovascular and lymphatic, but we've separated them in terms of the new standard. On the right, you see renal and genitourinary. It's been replaced by genital and reproductive health, item 9 on the left-hand side, and then a separate item on renal and urologic systems. So you can see the changes in terms of professional education. Now, what about evaluation? So this is we're still under professional education. There is a subsection on evaluation and examination, okay? In the old system, it was examination. Now we've combined them to be examination and evaluation. Let me just show this to you. The one on the right, okay? So it says there, history, screening, and systems, because this is examination. But remember, we combined examination and evaluation. So now you can see here on the left, you have all the systems in place, right? And then under each of them, you have examination and evaluation. Does that make sense? Okay, because in the old one, examination is separate, and then evaluation is separate. And so it goes to that one, okay? And what you will see, if you were an evaluator, is that when you look at the coursework tool, there is an appendix that they look at, and they want to make sure that all of those have been checked off. But in the new tool, or in the proposed tool, it's different. So I'll show that in just a moment. So previously you had Appendix A. We still have a new appendix, but this time, instead of having everything as required, okay, there needs to just be, not just, but there needs to be adequately covered in the curriculum, okay, in terms of those. So what do those look like? So this is what it looks like. So this is the new grid that accompanies this particular section. So you can see here all the, on the left-hand side, all the 17 things under examination evaluation. And then on the right, the things, and then on the top part are all the systems. And this is just an example of where evaluators can look at, has this been covered, has this been covered, has this been covered? I know in Coursework Tool 5, there was a rule about 75%. And in Coursework Tool 6, it was required. But here, there has to be representation. Does that make sense? So that's a change in that one. So these are just examples of how it's completed. So you can still see in terms of examination, all the exam things are still there, right? The tossed salad that Doreen has mentioned. Okay, what about still under professional education? There's a place called clinical decision-making and plan of care development. It used to be evaluation in the 2016 standard, but now the new standard is a little more, here, let me show you. So remember, the old one had examination evaluation separate. The new one has it together, but now look at what it has also. Clinical decision-making and plan of care development. So you can see some of the things that have changed from 2016 to 2025. Look at item 2, problem identification. That's item 2 on the right. It's now consistent with ICF language in terms of impairment and function limitation identification. When you look at 2016 item 4, you have prognosis and goal formation. It's now been disaggregated to where on the left you find diagnosis and prognosis in one and goal formulation in another. So I know this is a little bit granular, and this is now in the FSBPT board for review and then approval, and I'm sure they will disseminate this. So again, still professional education. I just wanted to show you, just to highlight, emergency procedures, okay? Used to be under plan of care. In plan of care on the left, you find there intervention and management. Intervention and management. Intervention is the physical act of doing certain things, right? Management is a broader perspective on how you manage the patient throughout the episode of care. And ClinEd, as I said, has been reduced based on the hours that was referenced a while ago in terms of CAPTE. So you can see that there. Just a minor language on the right, you see there, we removed the word disease on that language as it translates to the left. And related professional coursework, here are some of the things that, in this particular aspect of it, is really unchanged, except for under item 12 to the right, you replaced cultural competency with cultural humility. And then the new item that's listed there is, remember we removed emergency procedures, now it's here, okay, under related professional coursework. So that's the gist of the PT, all right? Now let's look at the PTA. It's not as involved, so if you could just bear with me for just a moment. All right, so in terms of PTA, there's foundational studies. So they looked at some of the gen ed courses in their curriculum, and they made some changes that I wanted to show you. So these are word changes. So when you look at under the humanities, look at item 1 on the right, and then on the left, English became English language. When you look at item 6, art, it now became visual arts. And then when you look at music, it's now performing arts, all right? So that's there under PTA. Applied science and technical education, this is now in the PTA curriculum. You can look at, again, some wording changes that are consistent with the current language in the standards. So let me show you that to you. So pretty much they're the same, but look at item 5. In the 2016 version, it's nervous system. It's now neurologic system. Okay? And then respiratory on the right becomes pulmonary on the left. And then item 13, hematologic, hepatic biliary systems. On the left, it's now separated. Hematologic, hepatic, and biliary systems. What about clinical sciences? So there is some expansion in the wording. And I wanted to show you that. So when you look at the one on the right, you can see items 1 and 2, pediatric and geriatric conditions. On the left, they've expanded it to say pediatric health and surgical conditions, okay, for both pediatric and geriatric. There's new content on health and wellness and pharmacology that is included in the new PTA standards. And again, this is for foreign trained, so this is not with your curriculum. if you're an accredited program. Does that make sense? So this is for the internationally educated PT assistants. So what is under health and wellness? Here are just some of the things that are listed there. Understanding what health and wellness is, how do you translate that to pathophysiology? How do you include that in, for example, fault prevention techniques, long-term health strategy? So these are all considerations when it comes to health and wellness, okay? When it comes to pharmacology, it can be integrated in the content that you already have in the curriculum. It may be integrated in coursework, pathophysiology, clin-ed, and some of the topics might include drug classification, side effects, timing relative to therapy, and then communication with the supervising PT or nursing regarding those medication-related issues. So this is for PTA. Okay. And so with regard to clinical decision-making, I just wanted to show you some things here. They added the word recognize down there in the bottom. Instead, you say withhold, recognize, then withhold. Does that make sense? So these are just some of the language that have been massaged into the new standards to make it appropriate. And then some of the things with the other systems. I just wanted you to look at what's new. Growth and human development, pain and pain experience, psychosocial and mental aspects of mental health aspects. Just like in the PT program, there is a matrix that, they can identify whether or not content is covered in those matrices. And then in terms of interventions, just wanted to show you what's new are the systems. Okay? The systems. And of course, they come in with their own matrices. So again, this is very granular, but I just wanted to show you what it looks like for credentials evaluators. And again, for you who are educators, PT and PTA, if you're CAPTE accredited, this does not pertain to you. This pertains to the foreign educated or the internationally educated in terms of standards they need to be looking at. Okay? So, that being said, are there any questions? I know we have about 10 minutes left. Yes.
I have a question about the evaluation of a student a graduate of a school that used to be CAPTE accredited and it lost its accreditation. How is that student evaluated?
If I can paraphrase, those programs that were internationally accredited, because CAPTE still has one international accredited program, the rest of the United States. There were a number of Canadian programs from the Netherlands, et cetera, but they did not move to the DPT, so therefore they couldn't stay accredited. So if somebody is going to those programs, they would have to go through this process.
What about U.S. educated? Like, let's say there's a U.S. school that lost its accreditation, and then you have a student who is U.S. educated but would not go through the international coursework tool to become.
Correct. So when a program has their accreditation withdrawn, very rarely will they go from like green light to red light.
Okay.
There's usually a warning, a probationary period, again, time to come into compliance. The way the CAPTE rules are written is whatever the cohort that's set to graduate, they are eligible if the accreditation withdrawn to sit for the MPTE, but not the other students. Again, as the programs are being told that their accreditation is being withdrawn, they do have to provide a teach-out plan. So whatever that piece might go along to that. So they cannot do an alternate route because they have been a student in this program. They may try to transfer to another program if the transfer credits, but that's institutional specific.
Oh, wow. So like if they don't accept the credits, then it's just.
Right, so
start over?
right, because an institution has to accept the responsibility. Let's say you took anatomy in X school, but all you have left is your clinical. How do I know you really know your skills and your anatomy? So that's why it's institutional specific, whether they take students with transfer credit or not.
Yes.
Yeah, so Paul Klaponis from Florida. So we look at this coursework tool, and we've had to look at it many times at board meetings. It's not really a true equivalency to an American education, because an American bachelor's degree is typically 120 credits, and the typical DPT program ranges from 115 to 135 credits. Can you speak to that, please? Because what I heard earlier was that it's 90 pre-professional credits and 96 professional credits. So those don't match the numbers to an American education.
The new CAPTE standard says the minimum is 96 credit hours. So that's where the 96 professional credit hours came from. There's also the model of a 3+ program or an early assurance program that students can have 3 years of undergraduate accreditation and show the equivalency of a minor with upper division courses that then allows what is their senior year to really become their first professional year. So typically if you go by a 30-hour, 15 credit semester, those 90 hours are very typical of these early assurance, freshman admission, 3+ programs. And I think from CAPTE standpoint, from the DPT, that does represent about 1/5 to 1/6 of the programs, and that is becoming even more typical.
So, being an old timer, the elephant in the room is that we're granting a doctorate degree with less professional training coming up. I mean, that's the elephant in the room to me. I have practiced for 43 years. You know, we're granting a DPT, and then we call it in the same breath an entry level. Whereas the true doctor equivalent, they graduate medical school, and then they go to 4 years of residency, and then can truly practice independently after they walk across the residency stage. But our PTs really can't. And that's based on being a clinical educator.
Thank you for the comment. Just as an aside to that, the profession did try to move toward a medical model, but it has fizzled out when we looked at doing residencies, but that had some issues. But we could talk about that later. Yes.
I have a question. I'm Pawan Kumar Raja from Maryland Board. I'm a foreign educated person too. So I went through CWT 6 evaluation, 5 and 6. So my question is, why physics and chemistry is needed for the tool evaluation? I'll support that according how you're answering it.
So the question is why?
Physics and chemistry are part of the tool.
Correct. So why now increase from 1 to 2?
That, based on our research, was largely driven by what is currently required by a majority of US-based programs. So I would say, don't quote me on this, but it was in the vast, like 80-90% of US programs require at a minimum of 2 courses in chemistry and physics. So based on that, and to ensure equivalency of the education that, you know, internationally educated students are coming in with, we upped it to that as well.
Thank you. I just wanted to add something else. So physics and chemistry are as well, including mathematics, are part of a formal education. I'm from India, so there are many categories too, like school level and intermediate level, where we do many other things like chemistry, physics, and everything. The only thing is, like, considering CWT5 evaluation, is done based on the university sending the transcripts to the United States, which usually doesn't happen from the college level. From the professional level, like undergraduate degree, that do happen formally. They do send it to United States for the evaluation. So those general credits are usually ignored with the evaluation, even though they have they rightfully have the transcript, but there's no sources which from the university level which sends with a sealed copy to you. So that actually leads us for a foreign educated person like me or someone else come with an evaluation assessment with lagging of those courses, which we either go through CLEP program to redo them again and send it back to you. So my personal struggle was, it was a funny one, that I was lagging mathematics, which I left probably like 12 years ago in my schooling. And I had to run behind a mathematic person who's doing his master's, he's a student, to learn the basics of the mathematics, than to get into CLEP program. And because it's too complicated, once you get into the professional level, to get back to the general things, because professionally, like my evaluation was competent enough for the programs, like either the master, doctorate level program. So which made me do my master's level. Once I got my CLEP cleared, that's when I got a CWT for evaluation done, and which was useful for me for the further education and other things. I just wanted to know that is there any exemption which we can make or any other way, because that just like the general education things like in high school or like intermediate, which we say like that's where it is a bridge between the college level and the high school level. So those schools doesn't understand the importance of sending those kind of transcripts with a sealed copy for the further evaluation to United States.
I mean, thank you for providing that feedback. I don't know if I can answer that immediately at the moment, but I do know that as credentials evaluators, they look at what's provided to them and then assess those credentials appropriately. So if it was not part of those credentials, then that becomes an issue. But thank you for raising that. That's very important.
I'll make it very quick. I'm a CAPTE surveyor, so I appreciate all the work that you do. Just to what Raja is saying, I had to go through a similar process. I took TOEFL, I took TSC, which is Test of Spoken English. I was all over Dallas downtown doing art appreciation, music appreciation, macroeconomics, all kinds of general education. Here I am after 20 years or whatever, right? That being said, my question is in Virginia, California, Oregon, and a couple of other states, which is Pennsylvania and Minnesota, we still have to do 1,000 hours of additional internship under a licensed physical therapist after even going through all of this process if you're an entry-level physical therapist. Why is that these 5 states require us to go through that and rest of the states don't have to go through that? Anyone has an answer?
I mean, thank you for that feedback. I think it's important to look at.
State rights.
Yeah, state right. You have 53 jurisdictions and 53 issues. I think what's important is that when coursework tools like this and reports come out, they are advisory, and the board makes the decision. So when it comes to states' rights and individual assessments, it's the board who decides. They look at this as part of what is advisory to them. So 30 seconds left. Thank you so much for being here. We'll be here if, oh, you have one more? Sorry.
I'll make it quick. First of all, thank you for your presentation. It was terrific. Considering the 96-hour minimum for CAPTE standards, how many schools of the 314 actually exceed this? And I'm thinking about this in context of student debt. I mean, if people brought some of these hours down, are they still going to be able to pass the NPTE? If they have 20 more hours than 96, do they have, I mean, where's the value? Just curious as to hear your thoughts.
Hold it, stop, so we can talk real quick. So it used to be 90, it went up to 96. It started when they became the accelerated 2-year models out there. So you could do a DPT program with no vacations going straight through in 2 years. So programs have been kind of looking at this. A lot of programs are going from the 3-year model to the 2.5-year. That kind of is now really in kind of the sweet spot. And so what's happening, and could relate to your board scores, what happens when you lose a semester of work? What happens when you try to truncate it? So lots of change happening in higher education. Again, the cut of semester cost savings and debt to the student.
Thank you.
Thank you. Don't
everyone.
forget your course evaluations. Thank you.